Thank you, Monica. Thanks for not telling people what you really think of me. Good morning, everyone. Great to see you today. My name is Ryan Meili, and I'm pretty happy to be here with the Upstream crew. I do want to thank Monica for acknowledging what happened in Saskatchewan last night. Certainly that's where my mind is, and thinking about, well, all the friends back home and family members who are thinking about their loved ones that are lost, and just the way, that's part of our life in Saskatchewan. It's a big place with not a lot of people, so we spend a lot of time on the highway, and we're always sending our kids out on school buses and hockey trips, and it's a pretty big thing. And was thinking a lot about my friends working in emergency, working in the healthcare system, responding to that kind of tragedy, the sort of thing that we're all trying to work to avoid. I want to thank Monica for the work she's doing, and Jared and Alex and Joanna with making Upstream thrive. It is really something to come back to an organization that I had a hand in starting, and now am very removed from. My day-to-day work has me living a block away from the office, but not getting to engage with Upstream very often. And to come back and see it thriving, and see a great group here today, and see the lineup of speakers and the strength and quality of ideas that are being brought together to discuss, it's so encouraging. When I think about what we're asked to discuss today, there's one word that keeps coming back to mind, and that's story. And I was listening to Tanya last night and listening to her story of the 7 fallen feathers and the way that she recounted the way she dug into that story. And I was thinking about how much story connects us all, how much that's the foundation of the way we communicate with each other, the way we understand ourselves. And so I wanted to tell you just a very little bit of my story and Upstream's story, and then think a little bit about how that informs the discussion going forward. I grew up on a farm in southwest Saskatchewan. Somewhere along the line, I got interested in health, and I got interested in social justice and the inequities that exist in the world. And that thinking led me to study medicine and to practice as a family physician all over rural Saskatchewan, including in northern Saskatchewan, and for the last several years in the inner city in Saskatoon, working in a clinic where we see high levels of HIV, of diabetes, of other conditions, of addictions, conditions directly related to poverty, to marginalization. And I loved doing that work. I loved being a family physician, having that person come and sit down in front of you and tell you their story, and sharing their vulnerabilities and being able to help just a little bit. I used to say when I was going into medicine that I thought the job was going to be making friends all day. And I was extremely naive. And 10 years into practice, I was still that naive, because I was still making friends all day and loving that experience. But also going home at the end of the day frustrated, because I knew that while I could help out with a prescription or some advice or a referral, I sent people back into the conditions that made them sick in the first place. And that so long as we weren't addressing what we're all discussing today, the social determinants of health, then everything we're doing in medicine is just trying to put a Band-Aid on a gaping wound. And so that's what led me to get involved in Upstream, to get involved in political life, to write a book called A Healthy Society. And in that book, what I did was I used the stories that had been shared with me whenever I could with permission. Some people weren't with us anymore, unfortunately. But I shared those stories to try to illustrate the way the social determinants play out in the lives of individuals, and use that to shine a light on what our policy options are, what our political approach could be if we had health as our primary goal and our understanding of the social determinants as the roadmap to lead us to that destination. And that's where Upstream came out of, was the discussions emerging around that book and the growing group of people that are thinking exactly this way. And what we were trying to do with Upstream, what we are trying to do with Upstream, what's our tagline? evidence-based, people-centered ideas to build a healthy society. So taking that evidence base, looking at what the best ideas are, what the information tells us will work, and connecting that to people's stories, and sharing those stories in a way that brings people's attention to what those solutions could be. And it's fitting, since stories are so much a part of what we're about, where we recognize that sometimes to get to a great big idea like climate change or reconciliation, the best way to start is with the way it affects one person, the way one kid is showing up in an emergency room in Saskatoon because their asthma's out of control because of the wildfires in the north that are directly related to climate change. The way we can connect down to a real person's life, those big concepts sometimes allow us to talk about those big concepts more freely and more productively. And it's fitting that Upstream is named for a story. The story of that we always talk about, and hopefully most of you have seen our little animated video of this, but where we ask people to imagine that they're standing at the edge of the river and they see a child in the water and that kid is drowning, and they dive in and they pull that kid to shore. They save a life, which is great. But along comes kid number 2, kid number 3. Eventually, hopefully somebody says, hey, who keeps chucking these kids in the river in the first place? And they go up and they try to find out and they try to stop it. And that story, we keep coming back to that story throughout our work with Upstream as the real foundation. And I couldn't help but thinking about that story, listening to the stories of the 7 fallen feathers, of literal kids in the river, and how that connected to the real tragedies that exist in our society, the way in which the social determinants of health are playing out in lives that are dealing with more sickness or that are ending far too soon in our country. And the way in which we think about and talk about the story of Inuit and Métis and First Nations people in this country, and the way that that has become a story we're discussing far more. And that's a very positive thing. As we shine a light on the history and the current colonization and marginalization of Indigenous peoples, as we talk about residential schools and 60s scoop and intergenerational trauma and all of these things that we see every day playing out in the health outcomes and in the realities, the great inequities that exist in health, in justice, in income, in education. And that, as we talk about truth and reconciliation, that truth of telling that part of the story is so essential, that we shine a light on what is wrong. But I also think we need to be talking about what is right. When we tell this story, when we talk about the stories, when we hear in their own voices the stories of First Nations and Métis and Inuit people in this country, we need to also be hearing the story of resilience, of strength, of culture, of knowledge, of leadership, and of stories themselves. It's so much a part of the cultures that I've had a chance, whether it's Dene folks in northern Saskatchewan or Métis and Cree people that I've worked with and my neighbors in Saskatoon, so much of the way we try to understand each other is through stories. And that, to me, is, as we think about this nation, as we think about this country and the project that we're on of trying to make it a better place, it's that understanding that we've been told this story for a very long time. In Saskatchewan and around the country, we've been told this story that this is as good as it gets, that we're stuck, that the number of reserve communities that have boiled water advisories, that's just something we have to deal with, that no schools in Northern Ontario is something that is just, that's something we can't do anything about. We're stuck with that reality, that the levels of poverty, the levels of illness, that's just the cost of doing business, and to disrupt that would disrupt everything, that we can't overcome these inequities. And I really can't stand that story. I can't stand that story because it's painful, it's wrong, it hurts people, but it's also garbage. Right? It's not true. We live in a place of incredible abundance. We are an enormously wealthy and enormously capable country. In order to achieve the potential of this country, we have to recognize that there's a better story, that we can do better, that we can move beyond the nice words of reconciliation. We acknowledge the territory that we're on today unceded Algonquin territory. Every day I'm in Treaty 4 or Treaty 6, and we acknowledge that, and we think about those things, and that's great. But let's move beyond that acknowledgement. Let's move beyond that discussion into action. Let's close the gap in health, in justice, in income, in education. This is something that we can do. We have the resources, we have the knowledge, we have the evidence, we have the stories to do so. In order to do so, we need to come together and say, yes, it's possible. And this, my vision of, my understanding, my conceptualization of reconciliation is writing the story with the truth in mind, knowing what's wrong, but coming together to write the story together of how it should be, of what good looks like for Canada. So I'm so excited to listen to Marcia, to Natan, to all the speakers that are here today. This Closing the Gap event is always something that leaves me more informed and more inspired. And I thank you for being here today. Look forward to the discussion.